Hello and welcome. Let's talk about common daily activities that damage the kidneys. Every day, there are simple habits that can unknowingly damage our kidneys. Because more than 90% of people do not recognize the symptoms of kidney damage until it becomes severe. By practicing good habits daily, we can keep our kidneys healthy. There are simple activities that gradually damage them without us noticing. So let's find out what activities cause problems to the kidneys. Number one, excessive sugar consumption. The first common and harmful habit is excessive consumption of sugar or sweets. Did you know that if our blood sugar level exceeds 180 milligram per deciliter, it starts to damage the kidneys because they work hard to remove the excess sugar through urination. This marks the beginning of their damage. Excess sugar in the blood damages the small blood vessels in the kidneys, which can lead to the loss of protein from our body known as proteinuria, which increases the risk of chronic kidney disease if left untreated and can lead to kidney failure. Excess consumption of sugar also raises blood pressure, further adding stress to the kidneys. There is also research showing that people who love sugar have a higher chance of developing kidney stones. Therefore, to keep the kidneys healthy, avoid excessive sugar consumption, avoid processed foods, and avoid carbonated sugary drinks. Instead, eat fresh fruits, vegetables, healthy fats, and good quality proteins, and avoid products made with sugar. Number two, excessive intake of salt. The second bad habit that damages the kidney is excessive use of salt in the diet. While an appropriate amount of salt or sodium chloride is essential for our entire body, an excessive amount can lead to kidney damage because the kidneys have to work harder to filter and eliminate the excess salt. Excessive intake of salt can cause an imbalance of sodium and potassium in the body, leading to high blood pressure problems that further increase the pressure on the kidneys. According to WHO, less than 2 grams of the salt should be used in various foods every day. But most people use 50% more salt than recommended. Many people are unaware that prepared foods often have high amounts of sodium or salt, causing kidney damage. Try using spices or seasoning in place of salt. Eat freshly bought foods rather than preserved packed foods. And follow a low salt habit typically achieved in 6 to 8 weeks, where you will come to prefer lower salt levels in food. Number three, excessive use of painkillers. Our second issue concerns the excessive and improper use of pain medications causing kidney damage, known medically as analgesic nephropathy. People who have been consuming painkillers for a long time often face this problem, especially those using acetaminophen or NSAIDs such as aspirin, ibuprofen, or naproxen excessively and improperly, causing kidney harm. Did you know that excessive use of these drugs has damaged thousands of kidneys? Therefore, it is important that if there is a need to consume pain medications daily, consult a doctor and adhere to every dose and duration recommended. Overuse of painkillers reduces blood flow to the kidneys, causing greater damage, especially for those with chronic kidney disease or at the end stage leading to kidney failure. Additionally, some pain medications can increase blood pressure, causing further kidney damage. Number four, not urinating at the right time. Fourth bad habit that can cause kidney damage is not urinating at the right time. When the need to urinate is felt and it is not done, it does not only cause problems for the kidneys but also affect overall health. When urine is not completely expelled from the body, it results in a state called hydronephrosis, where one or both kidneys swell due to excess fluids. And if untreated, severe hydronephrosis can lead to kidney failure. Moreover, continuously doing this increases the risk of urinary infection because when a lot of urine remains in the bladder, bacteria can proliferate, causing kidney infection. Furthermore, holding urine increases the pressure in the bladder and kidneys, leading to kidney damage. Therefore, if one wants to keep their kidneys healthy, urinate immediately when needed and take breaks from work to urinate if necessary. Number 5, drinking sodas. The fifth bad habit is excessive consumption of cola and soda. And the strange thing is that many people are aware that these can be harmful to the body, but they do not know how significantly harmful they can be to their kidneys. Do you know that when someone drinks too much soda, a lot of sugar and phosphoric acid enters the body, which causes kidney damage? Due to the high sugar content in these sodas, weight increases, the risk of diabetes and heart diseases rises, which are major risk factors for kidney disease. In addition, this phosphoric acid can also cause kidney stones that damage the kidneys. Studies show that people who regularly drink sodas are 58% more likely to develop chronic kidney diseases. Therefore, if you want to save your kidneys, give up soda and drink water, sugar-free tea, or low-fat milk instead. Number 6, excessive meat intake. At sixth, there is the excessive consumption of red meat. Eating red meat can increase acidity to aid digestion, which puts pressure on the kidneys, leading to kidney damage. Instead of red meat, consume other protein-rich foods such as fish, eggs, or plant-based protein sources, which reduces the risk of kidney damage because they produce less dietary acid and other compounds harmful to the kidneys. According to modern guidelines, people with chronic kidney disease can take 0.6 to 0.8 grams of proteins per kilogram of body weight. And if they are undergoing dialysis, they can consume 1 to 1.2 grams per kilogram of body weight. Number 7, ignoring urinary tract infection. At seventh, not treating urinary tract infection properly and ignoring it is a problem. This infection caused by bacteria can create issues in the entire urinary system, for which your doctor recommends antibiotics. However, the problem is that some people ignore it when it occurs, causing the infection to spread further and leading to kidney diseases like pyelonephritis, which can permanently damage the kidneys and cause sepsis, meaning pus formation. Therefore, it is very important that as soon as you experience burning during urination, pain, intermittent flow, or feeling that the bladder has not completely emptied, consult your doctor about it and seek treatment. Number 8, high blood pressure. If high blood pressure is not properly controlled, it can affect the blood vessels that carry blood to the kidneys, leading to a reduction in blood flow to the kidneys, and this is where kidney neglect begins. Additionally, the small vessels that perform filtration in the kidneys are also affected by high blood pressure, causing nephrons to be damaged because the delivery of oxygen and other nutrients to the nephron is insufficient due to damage to the blood vessels, resulting from high blood pressure. Consequently, nephrons cannot perform their functions, leading to further kidney damage. Therefore, it is important to keep kidneys healthy by controlling blood pressure. Number 9, not managing diabetes. In patients with diabetes, high sugar level cause damage to the blood vessels in the nephrons where blood is cleaned. When these are damaged, the kidney's performance becomes an issue which, if unavoidable, results in chronic kidney disease. 1 in every 3 diabetes patients has kidney problems. So, for these who do not properly control their blood sugar levels and have long-term diabetes, there is a higher possibility of kidney issues. This is why it is crucial to properly manage your diabetes and regularly check on it. Number 10, insufficient water intake. Lack of proper water intake can damage the kidneys. When we drink less water and urine is excessive, it leads to dehydration that causes imbalance in electrolytes like sodium, phosphate, and potassium, resulting in situations such as seizures or even loss of consciousness. Severe dehydration can lead to kidney failure and results in anemia, as well as an increased risk of stones or infections. Therefore, it is essential to drink the right amount of water, and for those with existing kidney issues, it is better to consult a doctor on how water management should be done. Number 11, smoking. The next habit is smoking, which can harm the kidneys. Consuming cigarette causes an increase in blood pressure and heart rate, leading to excessive strain on the kidneys. Moreover, smoking affects endothelial cells and damages the blood flow to the kidneys. Smoking also adds other risk factors for kidney diseases. Smoking affects renal functions, so it must be stopped for kidney health. These are some habits that can damage the kidneys. By removing these habits, you can maintain kidney health. Thanks for watching. Please subscribe to watch more. Have a nice day.